Hey everybody, this is Dr. Lori Langdon, board certified pediatrician, mama of 6 and grandmother to 2, with some things I need to tell you about flu. I live and work in North Carolina, and the southeastern part of the United States right now is getting slammed by flu. Specifically, locally, it's influenza A. So I want to update you on how things are going and how this is impacting everybody, some tips, and just some really heartfelt encouragement, guys. So it's everywhere. And even large practices now can often not guarantee that you can have a same day appointment for your child. Understand, we are trying to save appointments for the sickest. So we are very much at a time of this season triaging when you guys call in. So I would beg you to be patient with us in all of your pediatric offices. We are trying to do the very best we can. We are working hard. We are often double booking and staying late and working through lunch. So please be patient and kind to your healthcare workers. Also, I would encourage you to exercise a little bit of common sense. Let's say you have 3 children. One child has just this very week tested positive for influenza A. And then child 2 and child 3 begin to develop some runny nose, cough, congestion, body aches, and fever. What could it be? It could be flu. The other kid already had flu. Do you really need to take those 2 spots when we might have a child who's in respiratory distress or who needs breathing treatments? Now, obviously, if your child is genuinely sick and you need us to figure out what's going on, absolutely. I'm just saying, consider if 2 out of 3 kids already had it and now the 3rd's coming down, it's probably the same thing. Now, that brings up another point. It is important to be seen if your child needs Tamiflu. And so Tamiflu is an antiviral agent used to decrease the replication speed or reproduction speed of the viral particles, the virus itself. It doesn't actually treat the symptoms of the flu. And really, the bulk of flu treatment is just managing the symptoms, alternating ibuprofen or Tylenol for fever control, for pain control, encouraging fluids, monitoring urine output, making sure they're not in respiratory distress, keeping them comfortable, maybe a little Vicks Vapor Rub, definitely some honey if they're over 12 months old, that sort of thing. Comfort measures, right? So Tamiflu is not entirely necessary. In fact, in the area where I live, we're currently experiencing a shortage of Tamiflu, so often you can't get it anyway because the pharmacists are completely out of it. Actually, we're also having some shortages of amoxicillin, which we use for ear infections a lot, and various other upper respiratory bacterial infections. It does not help a virus like flu. We're having shortages on Adderall. It's just ridiculous, guys. Tylenol, Motrin, Tamiflu, amoxicillin, and Adderall, some of our most commonly used medicines we're short on. So anyway, don't feel like if you know your child has flu that they have to be seen just to prove that they have flu as long as they're doing okay. Obviously, we want to see them if they're not doing okay. Other things to remember, your child may return to school once they've been fever-free for 24 hours, even without fever medicines, and they're feeling well enough and strong enough to return to school. Keep doing all the things we learned in the pandemic to prevent spread of flu, but boy, is it contagious. It is also spread by respiratory droplets, so all the things you learned, coughing into your elbow, washing your hands after blowing your nose, all those things still help to prevent flu spread. If you're sick, don't go to work or school. You're just going to spread it. It is so very important. We are still seeing some some RSV these days. We're seeing tons of flu. But flu A is winning the game right now. We are one Saturday recently, out of 9 patients that we swabbed in a Saturday morning, 8 came back positive for flu A. And I was surprised the 9th one didn't. I bet they had it. They looked that sick. We are seeing so much of it. So I would beg you to not only be patient with us, trying to get you in on same day appointments, to be careful about who does or doesn't need to be seen. Try not to waste those appointments. Because trust me, if your kid has this very minimal rash and it's not even bothering them, you don't want to be in our office right now because there's so much flu there. We are trying desperately hard not to spread it, especially to our newborns. A lot of offices have specific policies. Maybe if your child has a high fever, they come in the back door or things like that. Or we have a special room we save that's clean for the newborns. Most offices have some sort of policies in place to try to prevent cross-contamination or infecting people that are there for well visits. Also, guys, please be kind to us and show some common decency and love for your healthcare workers. Remember, we used masks before the pandemic. Remember, if your child had flu in the office, we used to test by rapid antigen test. So before you left, we would bring in your masks and take you out the back door. But remember how we always use masks when we suspected your child had a flu infection? It's the same now. Most all healthcare facilities are still requiring mask use only because leftover from the pandemic, but they surely need to be now because of the flu. So even if your healthcare facility doesn't require masks for the patients, for crying out loud, of course you're supposed to wear them if you have a fever and respiratory symptoms and coughing. Guys, come on. So you should not be walking into an office to infect everyone else with your flu respiratory droplets without wearing a mask. That's really rude to us. And kids, as I'm trying to check them, they so often cough right in my face. We are human beings. We catch viruses too. And if anything, we're getting old and we don't need the flu and RSV and COVID over and over and over again. Please show some courtesy and just some care for those around you by protecting them from the flu. Don't feel like you have to have Tamiflu. Be careful about when you call to come in. Realize that we may not always be able to work you in on the very same day. I hope this was helpful, guys. Good luck out there. It's got to get better soon, I hope. Also, I was going to tell you, there is so much flu A activity right now in this part of the world, including RSV, also in addition to that, and additional respiratory viruses, that many of the pediatric beds across our state are filled. And leadership within the North Carolina Pediatric Society is amazing, and they have developed a resource, an online tool for physicians that's housed on the website of the NCP Society to allow them to find beds. That's how bad this is. Pediatric inpatient beds, particularly PICU ones, the pediatric intensive care unit ones, are at such premium that physicians are having to figure out where they can even send babies that have room to admit them. So this is really a tricky time for the little ones, especially with RSV or flu that's really making them sick. So be careful out there not to spread germs to those little tiny babies. Thanks.